The axilla or armpit is a pyramid-shaped space between the upper part of the arm and the side of the chest. It forms an important passage for nerves, blood and lymph vessels as they travel from the root of the neck to the upper limb. The apex of axilla is bounded in front by the clavicle, behind by the upper border of the scapula, and medially by the outer border of the first rib. The lower end or base is bounded in front by the anterior axillary fold and behind by the posterior axillary fold. And of course medially we have the chest wall and laterally we have the arm. The anterior axillary fold is actually the lower border of the pectoralis major muscle, and the posterior axillary fold is a tendon of latissimus dorsi and the teres major muscle. Here they are. The walls of the axilla are made up as follows. The anterior wall is formed by the pectoralis major, subclavius, and pectoralis minor muscles. Posterior wall is formed by the subscapularis muscle, latissimus dorsi, and teres major muscle from above down. The medial wall is formed by the upper 4 or 5 ribs and the intercostal spaces covered by the serratus anterior muscle. And finally, the lateral wall is formed by the coraca brachialis and biceps muscles in the bicipital groove of the humerus. There are some apertures in the posterior wall of axilla made by long head of the triceps brachii and adjacent muscles and bones. These apertures are the quadrangular space, the triangular space, and the triangular interval. The quadrangular space provides a passageway for the axillary nerve and posterior circumflex humeral artery to the shoulder joint and deltoid regions. The boundaries of this space are the inferior margin of the teres minor muscle. Here it is. The surgical neck of the humerus, the superior margin of the teres major muscle, and the lateral margin of the long head of the triceps brachii muscle. The triangular space is an area of communication between the axilla and the posterior scapular region. The circumflex scapular artery passes through it. Then viewed from posteriorly, it is formed by the medial margin of the long head of the triceps brachii muscle here, the superior margin of the teres major muscle here, and the inferior margin of the teres minor muscle. And finally, the triangular interval is bounded by the lateral margin of the long head of the triceps brachii, by the shaft of the humerus, and the inferior margin of the teres major muscle. The radial nerve and profundobrachial artery pass out of the axilla, traveling through this interval to reach the posterior compartment of the arm.